I'm Dr. Michael Hayes, board-certified gastroenterologist with 18 years of experience treating digestive disorders. And in my years of practice, I've seen thousands of cases of heartburn, acid reflux, and stomach inflammation. But there's one case that haunts me to this day. A 73-year-old retired teacher named Margaret from Arizona who walked into my office on a Tuesday afternoon complaining of what she thought was just normal aging-related heartburn. She'd been taking over-the-counter antacids for nearly 2 years, sometimes 4 or 5 tablets a day, and she genuinely believed that burning stomach pain was just something everyone her age had to live with. Her previous doctor had told her it was probably stress and dietary choices, handed her a prescription for a proton pump inhibitor, and sent her on her way. But when I ran the proper tests, what we found was shocking. Living inside her stomach lining was a spiral-shaped bacteria called Helicobacter pylori, or H. Pylori for short. And this microscopic organism had been silently destroying her stomach tissue for probably decades, creating inflammation, eroding the protective mucus layer, and setting the stage for ulcers and potentially something far worse, stomach cancer. And here's what terrified me most about Margaret's case. She had all the classic warning signs for years: the persistent burning that antacids only temporarily relieved, the occasional nausea, the feeling of fullness after eating just a small amount, the unexplained weight loss of about 12 pounds over 6 months. But because everyone told her this was normal for someone in their 70s, she never questioned it, never demanded deeper investigation, just kept swallowing those pink and white tablets thinking she was managing the problem, when in reality she was masking a bacterial infection that was progressively damaging her stomach. And Margaret is not alone. Studies show that approximately 30 to 40% of people in the United States are infected with H. pylori at some point in their lives, and the infection rate increases significantly with age, meaning if you're over 65, there's a very real chance this bacteria is living in your stomach right now, creating inflammation, increasing your risk of ulcers by 6 to 10 times, and raising your stomach cancer risk by 2 to 6 times compared to people without the infection. This is educational content only, not medical advice, and you should always consult your healthcare provider before making any changes to your treatment plan. Individual results may vary, and this information is meant to complement, not replace, professional medical care. Patient details have been changed to protect privacy, but the medical facts I'm sharing are based on current gastroenterological research and clinical practice guidelines. Now, before I go any deeper into this, I need to address 3 dangerous myths that are keeping millions of older adults from getting the treatment they desperately need. Myths that are so deeply ingrained in our culture that even some healthcare providers still believe them. And these myths are literally costing people their stomach health and in some cases their lives. The first myth, and this is the one I hear most often in my practice, is that heartburn and stomach burning are just normal parts of aging, that once you hit 60 or 70 years old, you should expect to have digestive discomfort, that it's inevitable, unavoidable, just something you have to accept like gray hair or reading glasses. And I'm here to tell you that this is absolutely, categorically, dangerously false. Yes, there are some age-related changes to the digestive system. The muscles of the esophagus may weaken slightly. Stomach acid production might decrease in some people. The emptying of the stomach can slow down a bit. But persistent burning, chronic inflammation, pain that wakes you up at night or interferes with your meals, that is not normal at any age. That is your body screaming that something is wrong, and in a significant percentage of cases, especially in older adults, that something is H. pylori infection. Let me explain exactly what happens when this bacteria colonizes your stomach. H. pylori is uniquely adapted to survive in the harsh acidic environment of the stomach. It has a corkscrew shape that allows it to burrow into the protective mucus layer that normally shields your stomach lining from acid. Once nestled in that mucus, it produces an enzyme called urease, which converts urea into ammonia, and ammonia neutralizes stomach acid in the immediate area around the bacteria, creating a little protective bubble where it can thrive. But here's where the damage begins. The presence of the bacteria triggers your immune system to attack. White blood cells flood the area, inflammatory chemicals are released, and while your immune system is trying to kill the bacteria, it's also damaging your own stomach tissue in the process. This creates chronic inflammation called gastritis. The stomach lining becomes red, swollen, more sensitive to acid, and over time, this inflammation can erode the protective barrier, leading to ulcers, which are actual holes or craters in the stomach lining. And if left untreated for years or decades, the chronic inflammation and cellular damage can lead to changes in the stomach cells themselves, a condition called intestinal metaplasia, which is a precancerous change. And yes, in some cases, this progression continues all the way to stomach cancer. So when someone tells you that burning stomach pain is just normal aging, what they're really telling you is to ignore a potential bacterial infection that could be progressively destroying your stomach. And that is not advice you should ever accept. Join the thousands of people who have already subscribed and transformed their digestive health by hitting that subscribe button now, because this community is growing and you don't want to be left behind with outdated information that could be putting your health at risk. Every single week, I publish videos that break down complex medical conditions into actionable information that you can use to advocate for yourself in the healthcare system. And subscribing ensures you never miss critical updates that could literally save your stomach or even your life. The second myth I need to destroy today is the belief that antacids or acid-suppressing medications actually cure stomach problems. I cannot tell you how many patients come into my office having taken these medications for 5, 10, even 20 years, believing they're treating the underlying issue, when in reality they're just masking symptoms while the real problem continues to fester beneath the surface. Let's be very clear about what antacids and proton pump inhibitors actually do. Antacids like Tums, Rolaids, or Maalox work by neutralizing stomach acid that's already been produced. They provide temporary relief, usually for 30 minutes to 2 hours, but they do absolutely nothing to address why you're experiencing burning in the first place. They're like putting a Band-Aid on a wound that needs stitches. Sure, it covers it up, but the underlying injury isn't healing. Proton pump inhibitors or PPIs like omeprazole, lansoprazole, or esomeprazole are more powerful. They actually reduce the production of stomach acid by blocking the enzyme system in the stomach lining that generates acid. And yes, they can provide significant symptom relief, which is why they're so commonly prescribed. But here's what most people don't understand. If your burning and inflammation are caused by H. pylori infection, suppressing acid production does not kill the bacteria. The bacteria is still there, still burrowing into your mucus layer, still triggering inflammation, still damaging tissue. The only difference is that with less acid in your stomach, you feel the burning less acutely, but the infection continues unchecked. And in fact, some research suggests that long-term PPI use in people with H. pylori infection might actually accelerate the progression toward more serious complications, because while you're suppressing acid and not feeling symptoms, the bacteria is free to cause more extensive damage. Without you realizing it, I had a patient, Richard, a 67-year-old retired postal worker from North Carolina, who had been on omeprazole for 12 years. His doctor kept refilling it year after year without ever investigating why he needed it. When Richard finally came to me because he started experiencing persistent nausea and early satiety, meaning he felt full after just a few bites of food, we did an endoscopy and found not only active H. pylori infection, but also multiple ulcers and areas of atrophic gastritis, which is when the stomach lining has been so damaged that it's actually thinning out and losing its normal structure. This is a precancerous condition, and Richard had been walking around with it for potentially years, all while his PPI was successfully suppressing his symptoms and making him think everything was fine. Now, don't misunderstand me. PPIs and antacids have their place in treatment. They can be incredibly helpful for managing symptoms while we address the underlying cause, and they're essential for healing ulcers once we've eradicated the bacteria, but they are not a cure. They are symptom management. And if you've been taking them for more than a few months without your doctor investigating why you need them, that's a red flag that something deeper is going on. Many patients may benefit from proper testing to identify whether H. pylori or another condition is the root cause of their symptoms. The third myth that drives me absolutely crazy is the idea that all stomach problems in older adults are caused by stress, poor diet, or eating too fast. Now, I'm not saying that stress and diet don't play a role in digestive health. They absolutely do. Chronic stress can affect gut motility, increase acid production in some people, and exacerbate symptoms. Eating spicy foods, drinking alcohol, consuming large meals late at night, all of these can trigger or worsen heartburn and inflammation. But here's the critical distinction. These factors are triggers and aggravators, not root causes. When H. pylori is involved, let me give you a real-world example. I had a patient named Dorothy, 71 years old, a retired nurse from Pennsylvania, extremely health conscious. She meditated daily, ate a pristine anti-inflammatory diet, lots of vegetables, lean proteins, whole grains. She avoided processed foods, didn't drink alcohol, didn't smoke, managed her stress beautifully, and yet she had persistent stomach burning that was getting progressively worse. Her previous doctor told her it must be stress. Despite her excellent stress management practices, suggested she try eliminating more foods from her diet. Maybe it was gluten, maybe it was dairy, maybe it was nightshades. Dorothy spent 6 months on an increasingly restricted diet, and her symptoms continued to worsen. She lost weight, developed anemia, started having dark tarry stools, which is a sign of bleeding in the digestive tract. When she finally came to me and we tested her, she had a raging H. pylori infection with multiple bleeding ulcers. The bacteria had nothing to do with her stress levels or her diet. It was an infection that required antibiotic treatment, period. And within 2 weeks of starting the proper antibiotic regimen combined with acid suppression, her symptoms started improving dramatically. Within 8 weeks, her ulcers had healed, her infection was eradicated, and she could return to eating normally without any burning at all. This is why the myth that everything is stress or diet is so dangerous, because it delays proper diagnosis and treatment. People spend months or years modifying their lifestyle, which is good and important, but if there's a bacterial infection underneath it all, those lifestyle changes alone will never solve the problem. And meanwhile, the infection is progressing, creating more damage, increasing cancer risk, potentially leading to complications that could have been easily prevented with proper testing and treatment. Let me know in the comments what medications you're currently taking for reflux or stomach burning, just general names, because it helps me understand what treatments people have tried and whether deeper investigation might be warranted for viewers in similar situations. Now let me explain the real science behind what H. pylori actually does to your stomach and why it's so dangerous. Especially for older adults, H. pylori is not a new discovery. It was first identified in 1983 by 2 Australian researchers, Barry Marshall and Robin Warren, who were so convinced of its role in ulcers that Marshall actually infected himself with the bacteria to prove it caused gastritis. They later won the Nobel Prize in Medicine in 2005 for this discovery, but despite decades of research and clear evidence, H. pylori infection remains underdiagnosed and undertreated, particularly in older populations. Here's how the infection typically works. H. pylori is usually acquired in childhood, often through close contact with infected family members, contaminated food or water, or poor sanitation. In developing countries, infection rates can be as high as 80 to 90%. In the United States, it's lower, around 30 to 40% overall, but significantly higher in older adults because they grew up in an era with different sanitation standards. Once the bacteria colonizes your stomach, it can persist for decades if not treated. Your immune system can't eliminate it on its own because the bacteria is so well adapted to the stomach environment, and this is where the long-term damage accumulates. The bacteria produces multiple virulence factors. These are proteins and enzymes that help it survive and cause damage. The urease enzyme I mentioned earlier creates that protective ammonia bubble, but it also directly damages stomach cells. H. pylori produces cytotoxin-associated gene A protein, called CAG-A, which is injected into stomach lining cells and interferes with their normal function, promoting inflammation and increasing cancer risk. It produces vacuolating cytotoxin A, called VAC-A, which creates holes in the membranes of stomach cells, weakening the protective barrier. All of this triggers a massive inflammatory response. Your body sends immune cells to attack the bacteria. These immune cells release chemicals like interleukin-8, tumor necrosis factor, and reactive oxygen species, all of which damage your own stomach tissue while trying to fight the infection. Over time, this chronic inflammation leads to several progressive changes. First, you develop chronic gastritis. The stomach lining is persistently inflamed, red, and irritated. This can cause symptoms like burning, nausea, bloating, and discomfort, especially after eating. Then, in many people, the inflammation becomes more severe in certain areas, particularly in the antrum, which is the lower part of the stomach near where it connects to the small intestine, or in the body of the stomach, the upper larger section. Depending on where the inflammation is most active and what strain of bacteria you have, you may develop different complications. If the inflammation and acid levels are high in the duodenum, the first part of the small intestine, you can develop duodenal ulcers. If the inflammation weakens the stomach lining itself, you can develop gastric ulcers. Both types of ulcers can bleed, cause severe pain, perforate through the stomach or intestinal wall, creating a medical emergency, or cause obstruction if scarring becomes severe. But even more concerning than ulcers is the cancer risk. Chronic H. pylori infection is classified by the World Health Organization as a Class 1 carcinogen, meaning there's definitive evidence that it causes cancer in humans. The mechanism is well understood. Decades of inflammation cause the stomach lining cells to undergo changes. First, you get atrophic gastritis, where the normal acid-producing cells die off and the stomach lining thins. Then intestinal metaplasia, where stomach cells start to look like intestinal cells. This is your body's attempt to adapt to chronic inflammation, but these abnormal cells are more prone to genetic mutations. Next can come dysplasia, which is when cells start to look abnormal and precancerous under the microscope. And finally, in some cases, gastric adenocarcinoma, which is stomach cancer. This progression doesn't happen in everyone with H. pylori. In fact, most infected people will never develop cancer, but the risk is significantly higher than in uninfected people. Studies show that eradicating H. pylori infection can reduce stomach cancer risk by 30 to 40%. And if you catch and treat the infection before precancerous changes occur, you can potentially prevent cancer altogether. This is why testing and treatment are so critical, especially for older adults who may have been carrying this infection for 50, 60, or 70 years. So what's the complete action protocol? How do you actually find out if you have H. pylori? And if you do, what's the treatment? First, testing. There are several ways to test for H. pylori infection. The most common non-invasive tests are the urea breath test, where you swallow a special solution containing tagged urea. If H. pylori is present, it breaks down the urea and you exhale tagged carbon dioxide, which is detected. This test is about 95% accurate. There's also a stool antigen test, which detects H. pylori proteins in your stool sample. This is also highly accurate, around 95%. Blood tests can detect antibodies to H. pylori, but these are less useful because antibodies can remain in your blood for years after an infection has been cleared. So a positive antibody test doesn't necessarily mean you have an active infection right now. The most definitive test is an upper endoscopy, where a gastroenterologist like myself uses a thin, flexible camera to look directly at your stomach lining. We can see inflammation, ulcers, or other abnormalities, and we can take tiny tissue samples called biopsies. These biopsies are tested for the presence of H. pylori using special stains or rapid urese tests. Endoscopy is typically recommended if you have alarm symptoms like difficulty swallowing, unexplained weight loss, persistent vomiting, bleeding, or if you're over 60 years old with new onset symptoms, because we need to rule out cancer and other serious conditions. Once H. pylori is confirmed, treatment is straightforward, but must be done properly. The standard treatment is called triple therapy or quadruple therapy. Triple therapy typically consists of 2 antibiotics, usually clarithromycin and amoxicillin or metronidazole, plus a proton pump inhibitor to reduce acid and help the antibiotics work better. This is taken for 10 to 14 days. Quadruple therapy adds bismuth subsalicylate, which is the active ingredient in Pepto-Bismol, along with 2 different antibiotics and a PPI, also for 10 to 14 days. Cure rates with these Regimens range from 70 to 90%, depending on antibiotic resistance patterns in your area, which is why it's crucial to take the full course exactly as prescribed, not stopping early even if you feel better, because incomplete treatment can lead to antibiotic resistance and treatment failure. After completing treatment, you should be retested 4 to 8 weeks later to confirm the infection is gone. This is typically done with a breath test or stool test, not a blood test, because we need to verify active eradication. If the first treatment doesn't work, your doctor can try a different antibiotic combination. Now, alongside the antibiotics, there are several supportive measures that may help optimize healing and reduce symptoms. Avoid foods and drinks that can irritate your stomach lining during treatment. This includes alcohol, caffeine, spicy foods, acidic foods like citrus and tomatoes, very hot or very cold foods. Eat smaller, more frequent meals than large meals. This reduces the amount of work your stomach has to do at any one time. Avoid eating within 3 to 4 hours of bedtime to reduce nighttime symptoms. Don't smoke. Smoking impairs healing and increases ulcer risk. Manage stress through whatever techniques work for you. Meditation, gentle exercise, deep breathing. While stress doesn't cause H. pylori, it can worsen symptoms and slow healing. Some patients find that probiotic supplementation during and after antibiotic treatment may help reduce antibiotic-related side effects like diarrhea and may support gut health, though you should discuss this with your doctor. Stay well hydrated, drink plenty of water throughout the day. After successful eradication, most people experience dramatic improvement in symptoms, the inflammation resolves, ulcers heal, and the risk of future complications drops significantly. However, reinfection can occur, especially if you live with others who are infected or if you're exposed to contaminated sources, so maintaining good hygiene practices is important. Wash hands thoroughly before eating and after using the bathroom. Avoid sharing eating utensils or drinking glasses. Ensure food is properly cooked and water is clean. Now, I need to be very clear about when you should seek immediate medical attention, because while H. pylori infection itself is usually treatable, the complications can be life-threatening. Seek emergency care immediately if you experience severe, sudden abdominal pain that doesn't go away. This could indicate a perforated ulcer, which is when an ulcer burns completely through the stomach or intestinal wall, creating a hole. This is a surgical emergency. Call 911 if you vomit blood or material that looks like coffee grounds. This indicates active bleeding in your stomach or esophagus. Also seek immediate care if you have black, tarry, or bloody stools. Black tarry stools called melena indicate bleeding in the upper digestive tract. The blood has been partially digested, which makes it appear black and sticky. Bright red blood in stools or bloody diarrhea can indicate lower digestive bleeding. Both require urgent evaluation. If you experience chest pain that radiates to your arm, jaw, or back, especially with sweating, shortness of breath, or nausea, call 911 immediately because this could indicate a heart attack, not a digestive problem, and it's critical to rule that out first. Seek medical attention within 24 hours if you have difficulty swallowing solids or liquids. This could indicate severe inflammation, stricture, or, in rare cases, cancer. Unexplained weight loss of more than 10 pounds over a few months needs investigation. Persistent vomiting that prevents you from keeping down food or liquids requires medical evaluation. Severe persistent heartburn or stomach pain, despite over-the-counter medications lasting more than 2 weeks, should be evaluated. Symptoms that wake you from sleep regularly need investigation. New onset of digestive symptoms after age 60 requires evaluation to rule out serious conditions. Fever combined with severe abdominal pain needs prompt attention. Any symptom that significantly interferes with your daily life, prevents you from eating, or causes you severe distress warrants medical consultation. Don't wait. Don't assume it will get better on its own. Don't let anyone tell you it's just normal aging. If something feels wrong, get it checked. The earlier we catch and treat H. pylori infection or any other serious stomach condition, the better the outcomes and the lower the risk of long-term complications. This information took me years to learn through clinical practice and staying current with gastroenterological research, And I'm giving it to you for free because I believe people deserve to understand what's happening in their bodies and how to advocate for proper care. All I ask is that you help me spread this potentially life-saving information, like this video, so the YouTube algorithm shows it to more people who are suffering unnecessarily. Subscribe to the channel because every single week I post evidence-based digestive health content that could make a real difference in your life. Share this video with anyone you know over 60 who complains about heartburn, stomach burning, or takes antacids regularly. You could literally save them from years of damage, or even catch a serious condition early. And leave a comment telling me your biggest takeaway, or whether you're going to ask your doctor about H. pylori testing, public commitment increases follow-through, and your comment could motivate someone else to take action. These 4 simple actions, liking, subscribing, sharing, and commenting, take less than 1 minute total but could change someone's life. Please don't keep this information to yourself when it could help so many people. And remember, this is educational content only, not medical advice. Always consult your healthcare provider before making any changes to your treatment plan. Individual results may vary, and this information is meant to complement, not replace, professional medical care. Thank you so much for watching all the way to the end. It tells me you're serious about your digestive health, and I'm here to support you every step of the way with reliable, science-based information you can trust.